Welcome to the show, Addiction Road to Recovery. I'm Carey Murphy, your host, and today we're lucky enough to have Dr. Igor Yakovenko on the show. And thank you for coming in.
You're very welcome. Happy to be here.
Tell us a little bit about who you are, what you do, if you wouldn't mind, so that the people watching can have an idea of who you are and what kind of work you do at this stage.
Well, as you already said, my name is Igor Yakovenko. I'm a psychologist, a clinical psychologist by training. I work in two different areas. I'm a researcher, an assistant professor of clinical psychology and psychiatry at Dalhousie University. And there I work in the Department of Psychology, Neuroscience, and Psychiatry, studying addictive behaviors, a variety of addictive behaviors, drug use, alcohol use, but also behavioral addictions. So that primarily includes gambling, but more recently, actually, video gaming as well, and some investigative work in social media usage. And I'm also a clinical psychologist who practices. So I work with Dartmouth Psychological Services in Dartmouth, Nova Scotia, where I specialize in assessment, mostly psychodiagnostic, helping individuals understand their mental health problems, provide diagnoses, clarify what's happening for them. And I also do some treatment in the area of general mental health, so helping individuals with substance use, addiction, depression, anxiety, related conditions, as well as couples therapy, where I also see some couples to help them with their relationships.
Well, that's why I wanted you on, because everybody's told me you're one of the top experts in the field, and I've had a gambling issue in my past, so this is how we got here. And I thought what we really need to do after the pandemic, the highlights have come out of how much addiction has increased, how much suicide has increased, and we're just trying to show people who have recovered from something and that there is a way to get better by different means. It can be clinical assessments like yourself, people who abstain from doing their problem behaviors, but we want to give them options and where they can go to get help. So in this case here, as a clinical psychologist, how do you define or how do you think of a gambling disorder? What is your opinion on that?
Well, gambling disorder is actually a mental health diagnosis in what we typically use in psychology to diagnose individuals. So Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, that's kind of the Bible of diagnosis in North America. And when a disorder makes it in there, a category of some sort, it basically means that there's been enough research and enough experience to be able to classify that behavior as potentially addictive. So gambling disorder is actually the only behavioral addiction classified as an addiction in the DSM. Everything else is drug or alcohol related. So there's no other behavior. So some people misuse the term addiction and they'll say, I'm addicted to all these other things, right? I'm addicted to phones, I'm addicted to TV, I'm addicted to food. But those are terms that are used by the lay public. Scientifically and clinically, we do not recognize those things as addictions yet. I say yet because it might change in the future. So for now, gambling disorder is the only one. And the best way to really think about it is that it's a loss of control over gambling. So we have 9 different criteria, and it covers a variety of different areas. But the best way to describe it is it covers a series of preoccupations with gambling. So thinking a lot about gambling, spending a lot of your time trying to figure out or plan gambling, losing control over it in the form of trying to chase after your losses. So this is going back to try to recover money when you lost it. And of course, having a lot of negative consequences associated with that. So we use the term functional impairment for it, but really just a way of saying that it's not an addiction until it harms your life. So there's a misconception often where people gauge whether somebody is addicted by how much they do something. And we actually don't use frequency of behavior at all in diagnosing addiction. So whether that's drinking or drug use, you could be drinking every day and it doesn't affect your life in any way, shape, or form, you're not addicted.
Right.
Same with gambling. I could be buying lottery tickets daily if I wanted to, but if it doesn't cause me financial trouble, it doesn't affect my relationship, my marriage, my work, my schooling, then it's not an addiction. It's not about how much you do it, it's about the loss of control. So gambling disorder really is losing control and having negative consequences as a result of gambling, regardless of how much you gamble.
Well, That's exactly what I've explained to people a lot of times, not quite in that scientific way. But basically, I find a lot of people who have been involved with gambling, it's a little different than drugs or alcohol, and sometimes there's crossover where they have both. But what I found with the gambling is if you are short and you have $700, you have to get $1,000, then the first thing crosses your mind, if I spend $100 trying to win it, then I can be okay. What usually happens 7 out of 10 times is that you will end up losing another 300 or 400. So instead of needing 300, you now need 700, and it just creates a bigger problem for you. That's kind of where I've seen a lot of people have that problem. How about yourself?
Absolutely. What you're describing is the kind of cognitive or thinking piece of gambling, right? The idea that you're thinking about gambling in a very specific way. It's a way to make money, right? It's not fun. It's making money.
Exactly.
And connected to that, we know we have a lot of research evidence and a lot of clinical experience observing what we call cognitive distortions related to gambling. So these are thinking errors that many gamblers who have lost control will show. So, for example, a very famous one that many will often hear about is called the gambler's fallacy, which is the idea that previous events are somehow predictive of future events. If I'm playing roulette and it's been red, I'll think, oh, if black hasn't come up in a while, so it must be coming soon, I'll bet on black. But that's wrong because it's entirely independent. It could be red for 400 times in a row because it's just random. All right, so this failure to perceive the kind of the statistical and probability events is characteristic of that loss of control. And what you're describing, the idea that if I spend 100, I'll make 1,000, I'll make 1,500, it again connects to that because it's about odds of winning, right? So for example, if you look at something like Lotto 649, the typical odds is like 1 in 17 million of winning. And yet how many people are buying it saying, maybe this is the one, let's do it, right? 1 in 17 million, right? Yeah. Would you ever spend, you will never win it in your life on average, ever. You'll just spend money on it. So the notion that you will spend money to make money is often connected to that thinking piece that's very characteristic of somebody who begins losing control and making those errors.
Well, and the other thing I found too, that right now, after the pandemic, people were sitting home. So now, back in my day, you had to go out and actually play. Now everything's online. You can deliver alcohol to your house. You can deliver drugs. Whatever you want can come there. And so people have gotten used to, in their bathrobes, playing casino games, and you can clean it out. I had a person come to me and say, look, my wife had this problem and she's done this. And really, it's one of those things where, what do you say to somebody? Because that person had maybe cleaned out their bank accounts and they're in trouble now and they don't know what to do with it. So I basically said to them, I said, you've got to get her some help because what's happening, this isn't the first time. So if you don't, you're going to be in a situation where it's going to be really bad and you're going to be in trouble. And that's why the show came to mind, is like, with people like yourself on the show, people who watch this, who maybe their husband or wife or child is having difficulties, will at least know where to go get help or realize there is some help.
Absolutely.
So, at this stage here, what are some of the treatments that you'd recommend or that science recommends for people who have a gambling addiction?
There are a variety of avenues that one can go to. As you described, gambling is tricky because it often affects the family, not just the individual, right? If you yourself lose all your money, go bankrupt, that's terrible. But if you also took down your whole family's wealth and fortune and savings with that, then your partner suffers, your kids suffer, whoever's around you. So we not only have to think about treatment and support for the gambler, but also for significant others who may be affected by this. Exactly. And so when we look at this research on what could help with gambling addiction, it kind of falls into those areas. Right. It's help for significant others, help for the gambler. When it comes to getting help for gambling, intuitively, those who struggle with addiction, including gambling, certainly try a lot of different things. Now, one of the statistics that probably most people are not aware of is very few people actually seek formal help. So less than 1 in 10 people will ever seek professional help in their lifetime who have gambling problems, right? So the idea that if we just create professional help and make it really widely available, everybody will just flock to it, is simply not supported.
Sure.
by the science, because for a variety of reasons, people don't necessarily want to go to get help, even if there is help available. And many barriers exist for that. Some of it is a desire to do it on their own. Some of it is stigma, right? Some of it is not knowing where to go, where to get help. So the notion of treatment or help is a tricky one because you have to think then, okay, if I open up a bunch of clinics and I deliver something like therapy to somebody who has a gambling problem, I'm only reaching about 10% of everyone who needs the help.
Right.
So then the 90% have to be somehow attended to or helped. And then, and with that, we have to take kind of a population health perspective. So the idea that you have to be able to message them or reach them somehow in a way that gets them to then come into treatment. And that's a part of recovery as well. Now, for the 10%, the evidence-based, the term we use for treatments that have been shown in science to be helpful, in research to be helpful, main one being cognitive behavioral therapy. And this is a style of therapy that's based on the idea that what we think really affects our emotions and our behaviors.
Right.
So the idea that you can't just, ban yourself from the casino. You can't just, lock out your access to the accounts. That's important. You're still going to be thinking about it a lot, and a lot of those thoughts are inaccurate, as I've mentioned before. Yes. So CBT, or cognitive behavioral therapy, focuses on the thoughts and how they connect to why you gamble and what prompts you to do it. By attending to them, by noticing them, by changing them, you're able to then prevent that loss of control or at least minimize it.
Exactly. Look, it's one of those things where what I've found from the people I've dealt with in my own problems in the past is that the biggest problem I find is that when people have an addiction problem, they go to stop. There's 8 to 10 hours a day that they're not doing that problem behavior, whatever it may be. How do you fill that gap? And that's where I think the biggest problem, people don't realize that they have to find something else to put in that spot, or else they're going to end up back where they started. That's just my personal opinion. I'm not sure what you feel about that.
Exactly. I think it's this idea of substitution is a tricky one because we actually don't have good evidence for the notion of an addictive personality. It kind of connects to this idea that if you have this gap, you're going to fill it with something. You need to do something in that time. Once an addict, always an addict. There's the saying. We don't have a lot of data to support that, but we do have a lot of science to suggest that preoccupation and what goes through your mind is very important. When you're not doing the behavior, you're thinking about it.
Right.
You're planning it. You're worrying about it, right? If you lose a bunch of money, you're worrying, how am I going to tell my partner? Oh, my God, I can't disclose this. Maybe I won't say anything. I'll just win it back over the next couple of months, and then it'll be okay. I won't get in a fight after, right?
Yeah,
of course,
exactly.
That leads to more and more losses. So thinking and preoccupation, as you highlighted, an important element, and that's what really gets addressed in treatment. To go back to just the previous question about things that tend to be helpful, cognitive behavioral therapy is one of them. Another type of therapy that's shown a lot of support and that seems to be helpful is called motivational interviewing. It's a style of therapy.
Okay.
And it's actually based on the idea that very few people who are addicted in general, not just those with gambling, do not understand why they do it or somehow are oblivious to the fact that it's hurting them. It's kind of like a smoker who cigarettes. If you go up to a smoker and tell them, hey, do you know smoking can cause cancer? No smoker goes, oh my God, I didn't know. I'm going to quit. Thank you for sharing that information. Yeah. They know, but they're ambivalent. There are two parts to them, right? One, a part of them understands the risks, does not want to do it, but another part wants to do it. Maybe it's exciting to gamble. Maybe it's a way to make back money to avoid pain and embarrassment and hurt in the family. So they know it's bad, but they also kind of want to do it, and this is kind of stuck in between. And motivational interviewing with a psychologist helps resolve that. So it's based on the notion that we are more convinced of things that we arrive at ourselves than what people tell us. Right? So if I tell you to stop gambling, you often resist because you told me.
Yeah.
People don't like being told what to do. But if you arrive there yourself and realize that on your own, then you're much more motivated to go and do it. And
exactly.
So that type of therapy is all about resolving that ambivalence and helping the person find internal motivation rather than just telling them to do something.
See, that's why I wanted you here, because those are things the average person doesn't know and doesn't realize are available. The last 2 years, 2.5 years, GA, NA, all the AA programs have been shut down because you weren't allowed to go there and talk to other people because of the COVID. And now you had to go online. A lot of people who were in the middle of that, who were trying to recover, did not have access to computers or this or that. So I think the results are showing up in the evidence of suicides, addiction increases, things like that. So this is why I needed someone like you on the show so we can say, look, there is a way out of this. We're not going to beat you down because you had an addiction problem. We want to praise you for getting better. And that's why I think we've been missing all this time is that people don't want to pat people on the back and say, hey, you did a good job. And I think that keeps you on that right path. And I think that's what we're trying to do with the show is just that right there, right? So that's why I need you here. You know what you're talking about.
I hope so.
I've got another question for you, too. Are there any treatments that you feel don't work?
It's hard to say what doesn't work because when it comes to research and trying to figure out what is helpful, when we say stuff like evidence-based, what we really mean is we've done a bunch of studies, we've tried to see how a treatment works, is it better than other things, and time again, consistently using our gold standard research, this particular thing came out on top.
Right.
And it works. But if the other stuff didn't come out on top, it might mean a few things. One, we haven't done enough research on it. So a good example of that is GA, Gamblers Anonymous. So many people use it. You know, it's the original motto of recovery with Alcoholics Anonymous. Many people swear by it. But if you were to look at if it's evidence-based, the science will say no. But the reason is because we can't do studies on it. It's anonymous.
Yeah.
How do you follow up a person and check whether they're recovering without revealing their identity, right? So the nature of the treatment does not help, does not permit us to study it well. So maybe what I'll say is things that have not received support, leaving room open for the fact that we don't know if
Just
it's
not enough information on it. Yeah.
So GA is one of them. Gamblers Anonymous is one of them that we don't know how helpful it is for whom, how it works exactly. Supportive therapy isn't one of them. So we use that term to describe therapy where you go and you don't really have a goal. You're just chatting, right? And many individuals will experience this when they go into treatment, well, anywhere really, and they didn't get a counselor, a therapist, a psychologist who is versed in one of those treatments that work. What will happen is they'll kind of have a chat like they show in the movies. You know, you lay on the couch and you talk about your problems. And you walk away, and it feels nice. Of course it does. You talk about your problems. You maybe have secrets about gambling, and you can tell no one else, and you get to talk about them. So you walk away feeling good, but then nothing changes. You're still gambling. You haven't attended to those thoughts. You haven't attended to your behaviors. And then you come back to the therapy, and you do it again, and it feels good that day again. And you do it over and over and over and over. And a year later, you're wondering, I've been doing therapy for a year, and nothing's changed. That's because they've been doing this supportive psychotherapy where it's just support, good chats, good conversations, but it's not actually toward any kind of goal. It's not using any kind of techniques that help a person change their behaviors. And that's where we draw a line from evidence-based to non-evidence-based. So I would say that's another type of treatment. If you're an individual who goes to that type of therapy and finds themselves doing something over and over and over and asking, how come it doesn't work? You might be in one of those.
Well, and that's why, like I said, what we're trying to show people is that there's a myriad of different options available. People just don't know about it. And that's why someone like yourself can explain that there's differences, why this will work, why that won't work. And I think the biggest thing is information. We've been so afraid to talk about this issue, and now the pandemic's made it in the forefront. And when you see movie actors and things like that talking about this, it just highlights what's happening. And I think this is a time where the governments like Nova Scotia are putting big money into mental health for the first time. They're doing some things. And I think now there are going to be operations that can help people, like your place in Dartmouth, different things you're doing. And I think I just need to highlight that on the show. But the biggest thing is people who recover can have a good life again. That's the only. I have a fantastic life. I have wonderful children. I have everything I could ask for. But it's taken a long time to get there. And a lot of bumps and bruises on the way, but guess what? I'm here. So if I can show that to somebody else out there who's watching, that all I have to do is try to do this and try that. Like I said, whatever therapy you may want to use, GA. What I understood, and I heard this a long time ago, that about 7% of people actually recover who go to GA without the recidivism rate and things that happen. But I can't say that for sure either. I'm just going by numbers that get thrown around. So one more thing I want to ask you, first of all. Why don't you think problem gamblers seek help? What is the reason it stops them from going to get that help they need when you said only 10% really go out and get the help they need?
Well, some of the top barriers are the ones I listed previously. So a big one is a desire to do it on your own. So many individuals just, for whatever reason, call it pride, call it self-confidence, or just a wish to want to master something or overcome something yourself. They say, no, I can do this, right? I'm going to figure this out. And then they just keep pushing through it over and over and over, and it's just not getting places. Yeah. And so that can keep someone stuck in that non-seeking help mode for a while. Another one is stigma. We have come a long way toward destigmatizing mental health problems and addiction, but we are nowhere near where it needs to be. It's still very much looked down upon, right? If you see somebody who's struggling with addiction of any kind, you get judged, right? Yeah. And gambling is another one of those things, right? So they're afraid that if they disclose it to someone, if they admit to whoever that they have a gambling problem, they will be judged. They will be looked down upon, and maybe they will be, right? So that's a realistic fear.
Especially your job and something like that, you're really afraid. Yeah, no, you're right.
Absolutely. Yeah. The other one is lack of access to care. So there aren't a lot of available treatment options. For example, in Nova Scotia, we actually made tremendous strides recently because they created the Gambling Support Network. So for those who don't know, the Gambling Support Network in Nova Scotia specifically is a program run by our Department of Health and Wellness that provides anonymous 24-hour, 7 days a week access for gambling help. So you call a number, it's free. You get to talk to a clinician who's trained in being able to deliver some of these evidence-based techniques for free to support you, or if you're a significant other. So if you're a family member, you don't know what to do, your partner is gambling, your family member is gambling, you have no idea how to begin, you can call and talk to someone, and they can give you access to resources. They can tell you where to go, what to do, how to help, and it's free.
I did not see. That's the things that we want to get. What you said is exactly what the show is for, so people can realize there is help. You just have to know where to look for it, and that's what we're trying to do, just put their bricks along so people can walk along to find where they need to be to get help. So fantastic. So a quick question for you. That you said you had been on CNN a while back. So tell me a little bit about that experience.
It's been great. I mean, the conversations are often about a variety of topics. That specific one was about cannabis use. I've done some other print interviews with them for gambling. So it's the experience is generally positive almost always, because I think most people who want to do an interview, they're looking to find an answer to something to get a conversation started. So I've never really had disingenuous journalistic experiences.
Until today, sorry.
Well, this is a great experience so far as well. And it's been great. I think that my goal is always to get word out, to bring attention to issues, to highlight things that maybe are underfunded or need to be attended to. Gambling is unfortunately one of those things that gets often overlooked, and we can kind of understand that because relative to other disease burdens, it is smaller. So, for example, in Canada, about 2% of individuals will meet criteria for past year problem gambling or be at risk for a gambling disorder. So, 2% doesn't seem like a lot, but it's about 300,000 people when you break it down in terms of who gambles. And the comparative issue, so alcohol, of course, is the king of addictions. It still causes the most trouble, the most problems. You might say, well, gambling doesn't matter as much. So, of course, we'll direct more money, resources to everything else. But it can't be so disproportional that gambling gets almost nothing, which is kind of the case almost everywhere in Canada. Right? So the pendulum is too far in the other direction. If you think about it, for example, you can probably name some kind of centers locally or provincially or federally, or helplines or clinics for alcohol problems or drug rehabs. How many can you name for gambling?
Exactly.
Most people don't even know about it.
That's the problem we had. 23 years ago, we opened what was called the Douglas Murphy Outreach Center, called after my dad. And we got a grant from the Nova Scotia government to help people with problem gambling. And we did find there was crossover addictions, but most times that was the issue. The casino had just opened at that point in time. And they were saying that when you open a casino in the area, 6% of the population will become addicted because it's just a new thing in town. The biggest thing is, what I've noticed now is online betting and betting on sports is so popular now. You can't close Pandora's box once it's open, but how do we help the people who, like you said, are having the issues, the 2%? How do we get them help? And this is where the idea of the show came from after the pandemic, because I'm watching a hockey game and they go right to the betting odds. in the middle of the intermission. I've never saw that before. But at the end of the day, you realize, okay, it's here. Technology is beyond anything we've had in the past. But back in our day, we didn't have the kind of funding that's available now to help those people. And I remember back in the day, there was only 8 beds throughout the whole province for addiction services, period. And, so between the alcohol and the drugs and everything else, so gambling didn't have a whole lot of space. But you know what? I think the biggest thing is that I've learned and people I've dealt with, if you really want to do this and you get to that point where you've had enough, you will find a way if you really want to. If you don't, well, I don't think it really matters. That's my personal opinion, but I'm not a therapist. So.
Well, that's exactly right. I think that really connects to this idea of motivation and internal motivation. There was 30 years ago, maybe in the 80s, early 90s, the clinical world of treatment really abided by the philosophy of confrontation as a way to recovery. So the notion was, well, if I just tell you how bad things can get, right, then maybe you'll understand. Right? So one of my mentors that I studied with said that when he used to train, maybe it was even his mentor, they'd carry a picture of a cadaver in his pocket. So if you're with a client and he's smoking, you're trying to get him to stop smoking, you'd say, look, this is what will happen to you if you don't stop, right? And that doesn't work.
No.
So if somebody does not want to change, they will not change. You can do anything you want to, they're not doing it. And it comes back to that human nature, really, of we are convinced of things when we arrive at it ourselves. And I often run into this dilemma clinically because I'll have significant others of gamblers or substance users or whoever say, just tell me what to do. What can I do? Should I do an intervention? Should I stage, family gathering and everybody tells that person how worried they are about them? And the truth is, there's not much you can do except keep an open door, help them know that they can always talk about it. They won't be judged. They can reach out, that they can be understood, but you won't be able to make them do anything.
Right, exactly.
The best you can do, I don't even know what to call it the best, is that they will abide by your command that you are forcing on them for a little while.
Yeah.
So they'll be forced into treatment, they'll go begrudgingly, and they won't really want to go because they won't agree that they have a problem. They'll just say, well, my partner or whoever told me to go, so I'm doing it for them, my mother, my brother, my sister. That doesn't last because eventually their internal motivation to do the behavior, gambling in this case, wins out. So it might last for a year, 2 years, then it's back. So the idea is to provide an opportunity in a healthy, nurturing, supportive environment to help the person make that decision themselves and find the motivation.
Yeah, instead of the hardcore pitch, just say, listen, we have to get some help and try to see what's there. But I think there's more options today than there was 20 years ago. I guess the best way I can put it. People like you are out there who specialize in it. There's clinics and people like you are starting to do things. And I think more and more people will at least, I think the explosion is going to come from online gambling, from betting on sports, and young guys gaming. I mean, it's all over. Like, I can't believe they're actually getting paid to do, play games online. So as an older person, I can't comprehend it. My son's been very good to show me certain things, and it's just so big. You just don't realize how big this is. And if we kind of nip it in the bud now in the sense of giving options to people, maybe that 2% or 10% will get rushed to 15%. Like you said, when you consider 300,000 people, that's a nice increase. And each year, I think it might get a little better based on more and more information.
Absolutely. And I'm glad you highlighted the different avenues that you can now access gambling. I mean, one of the big risks we've seen now is that technology has made things real creative in how to gamble quickly and expensively, right? So you not only have the traditional forms of gambling, like sports and such online, but you now have things like fantasy sports, daily fantasy sports, right? So fantasy sports, you pick a roster of a team and play it out and see if you win. But daily fantasy sports allows you on your phone to do a whole season of play theoretically every day. So you can keep betting over and over and over and over and over, right? And spend money really fast. You also mentioned video gaming. One of the things that I study in my lab, but also has become quite popular, is gambling mechanisms in video games. So in young kids who play this a lot, and most games nowadays, I mean, if you look at the top 100 games on some of these stores, app stores and stuff you can buy on mobile devices, for example, up to 90% have some element of what they'll just describe as a loot box, which is basically a virtual box that you literally pay money for. So I play a game, I can spend $2 and get a virtual box, and I click on it, and I don't know what's in it. And once it opens, it's usually very glamorous and shiny and pops up. It can have something really awesome and cool for my character that I really, really want, or it can have nothing valuable.
Really?
And
So it's true gambling.
Right, exactly,
Yeah,
because it's the way we define gambling is scientifically is it's spending money on an uncertain outcome.
Right.
So you are getting an uncertain outcome in this little box. It could be good, it could be bad, and it's real money you're spending. And so there are kids who will borrow their mom's credit card and just keep going boop, 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 swipe, swipe, swipe. $500 later, they just bought 100 of these things, and mom is wondering why she has a $500 bill from a mobile video game. And this industry is now worth, by 2024, they're projecting in North America will be worth $50 billion.
It's amazing, isn't it? Well, back in the day, the companies that did the VLTs, Spilo was a company back then, and I had one of the representatives come to my center and talk to me about it a bit. And he said, basically, what we're trying to do is we've had the old ones just tick, tick, tick. Now we've got the interactive play. So the younger generation will be able to go hit that or do this, and it gets them more into the game. And like you said, now we've gone to a whole new level where you can actually get your little box for $2. See, I don't think you can stop that. What I think you can do is, well, the person I'm worried about is that 20 to 30-year-old who has a job, is working, and on his time off, he's spending a lot of money on this or betting online. Now, again, I don't think you can stop it, but I think if you have information that people can see, they may, without being really hard off about it and making it, here you have to do this, once they see the logic, then maybe we can be able, if you give them enough information without being, the way you were saying earlier about being so rough with it, people will decide for themselves at some point in time. I just want to give them those avenues. Mm-hmm. And I think that's what you're doing right now by what you're doing, your research and things. I mean, you're amazing.
Thank you. I appreciate you saying it. I don't know about that, but always nice to hear kind words.
No, but honestly, I've talked to a lot of different people on different subjects. We just did 10 shows on, like I did these shows back in 1998 on Channel 10. And when you're running the addiction center, you meet a lot of people with addictions and doctors and things. Today, it's much harder. If you want to do media, you have to go through the media for Nova Scotia government to even talk to anybody in the government. It's quite shocking, but it is what it is. And once you have people who you know inside, like there's a gentleman, Mr. Elliott, he's been fantastic with me with the media for Nova Scotia. He's got me people for the show. He's just worked his tail off, and I want to give him a little kudos. But Dr. Sherry, who we had talked to earlier, I saw him on CTV, and he said something to me that was so shocking because I've been out of the field for a long time, that from 2020 to 2022, suicides are up 89%. And I went, that can't be. That's just an impossible number for me to understand. So what do you think about something like that?
I believe it. There's one thing that I've discovered through my own personal experience working with just in the local community with a variety of mental health problems. And reading the research on this is that the pandemic has consequences that nobody's seen yet, which are the mental health ones.
Yeah.
And I don't think there was any appreciation for that during the pandemic, for good reasons. Everybody was focused on virus and death and illness, but through that whole time, we created a huge artificial environment of basically the perfect constellation of risks that we as psychologists know cause mental health problems. So
exactly.
Social isolation, not going out doing anything, right? Loss of job, which not only creates financial stress and such, but also meaning in life. So we know, for example, that people who have a lot of meaning in life and purpose, they're much more resilient to mental health problems. I saw an interesting article recently. I didn't read it in detail fully, but it was the headline was that an investigation to long COVID, and more people who were unemployed displayed symptoms of long COVID. So this idea that if you're kind of just sitting around at home, you don't have a purpose in life, you don't know what to do with yourself, maybe you lost your job, maybe you're not looking to go back because of COVID, you're much more vulnerable mentally to depression, anxiety, substance use. So suicide is a reflection of psychological pain, right? It's a symptom of depression. So if it's skyrocketing, what that's telling us is depression is skyrocketing.
Exactly.
And I think for those reasons and many others, that's going to continue because some of these things become long-lasting. Right? A lot of the disorders that we deal with, we call them recurring and relapsing, meaning that once you have it, it's really tough to come out of it. You can, but it's tough. And so if you have the onset of something like depression, major depressive disorder, for example, when you start getting these episodes, it's not going to be, next month you're feeling well. It's going to be some ups and downs. It's going to be some struggles to deal with it. So it might be years before you're back on the road to feeling healthy again.
Exactly.
And so I think we're going to keep seeing it happen. And I think it's a tremendous shame because we're not really attending much to it. I think the focus is still very much on economical recovery. And that's important, don't get me wrong. But how many news stories do you read out there about new government programs for mental health support post-recovery? Those are minimal, if any.
Well, that's why in Nova Scotia, they came in with that, and I was quite impressed that they actually made that a part of their agenda, and they've kind of lived up to it. And you'd know more than I would because you're in the field every day. So what do you think about that side of it? Is the government kind of doing a little bit more in Nova Scotia than they maybe did in the past, do you think?
Absolutely. I think we hear a lot of criticism of the government, but I think that's the nature of things that whoever's in power, everybody's complaining about them. But I can say, practically speaking, we are seeing some significant changes in the province. We have had a huge increase in the budget allocated to mental health addiction recovery. It went from several 100,000 to millions. It's almost 100 million.
Exactly.
It's a huge increase, right? So you have more money, we can have more infrastructure, more programs. This is just for the community services. We are, of course, working on universal mental health coverage. So essentially what that means is MSI would be covering psychological services.
Nice.
That's going to take some time to figure out and work through because you have to figure out the logistics of how all that works. But I can tell you that it's moving along nicely because a lot of that is in consultation with psychologists around the province, major training bodies like Dalhousie, and I think that could be great for the province, right? If you increase access, if you can't afford the private psychologist at $200 an hour, you'll be able to go and see somebody and get the CBT and all these treatments that usually you have to get through a psychologist.
That's fantastic news. I mean, this is what I wanted. People don't understand that this government is trying. And if we can utilize what they put on the table and help people, it's amazing. Like, I didn't see any of those back in 1999, sorry, but this is a much better story. And you're involved with it every day with your teaching, your training, and with your research. So I'm just so happy you're here.
I'm happy to be here. Yeah, it's exciting times. I mean, there are always more things to do, and nobody does it perfectly, but we take our wins where we can get them, right? So whenever I see political movements or changes, and I always remind myself that it's easy being a critic of whatever's being done.
Exactly.
But movement forward is better than stagnation. And I think, for better or for worse, there's some kind of movement happening in Nova Scotia. So.
You're right. And I think Premier Houston has come out with that and understands there's an issue, and he's addressed it. And I think if he does well here with that, I think it'll go right across the country with more and more, because I think there are so many different ways. There's harm reduction, there's needle exchange, there's so many different programs, but nobody gets a real look at it. They only get to see it 5 seconds on the news or here, and they don't really know what's available. And I think that's something you must see more than anybody else, that when you're dealing with a client, that how do you explain to them this is available when it seems hidden underneath.
Yeah, that's actually a huge problem, because at the end of the day, I could tell you about all these wonderful scientific studies and findings and all these amazing treatments we have. But if nobody knows about them or knows how to access them, then who cares?
Exactly.
Right? Then we're all just sitting in our ivory towers and twiddling our thumbs and talking to each other.
But you do have a nice coach.
That's right. So a lot of work has to be done on promoting access and making information available, particularly in Nova Scotia. Nova Scotia has kind of a unique, I don't know if it's a dilemma, but it's something to pay attention to, in that we have more mental health professionals, psychologists and specifically I'll say, working in private care than public.
Right.
And that's unusual compared to some of the other provinces, because usually you have many more open spaces and jobs available in community. Here we have less of that, and so, of course, for obvious reasons, financial and such, psychologists tend to go into private systems.
Sure.
And it's great there, but not everybody can afford those fees. And so let's say 53% of psychologists are only available through the private sector. That means that many people won't access them ever. Doesn't matter how great of treatments they have. They won't know about them. They don't know how to get to them. They don't know how much it costs. They don't know if they have coverage. So we really need better ways to advertise public health systems. So like the Gambling Support Network, that's a great tool that's available for free from the government. And community services. I do think that if there were to be more improvements that haven't happened yet, it's in the public sector. So, for example, we have psychology positions in community mental health services here that are going unfilled for over a decade.
Really? I didn't know that.
I think it's 8 to 12 of them. I don't know the exact number, but why is that? Right. So we can ask the question that we want to be able to provide mental health services. Nobody's coming to work. And so is it not enough salary, not enough incentives, not enough retention of graduates? Is it something about Nova Scotia? And there isn't much investigation into that. So I think issues like that, where we can create outreach, improvement in public infrastructure
Exactly.
that increases access to care would be great. So perhaps, if I'm my own devil's advocate for all the good things that are happening, that is an avenue that could still be improved.
No, that's the idea. Like if somebody happens to see this in the government, they might say, he's right. That's something we can work with. The other thing I found too is that PTSD has become such a huge issue the last 10 years or 15 years. And a lot of people I find who I've talked to who've had PTSD issues are in addiction problems because of the trying to escape from where they are. And I think a lot of psychologists and psychiatrists have gone down that route because there's a lot of federal government money that's available that maybe you wouldn't have had 20 years ago that you have now. What do you feel about that?
It's hard to say if treatment providers go in the direction of a disorder or disease, because generally most practitioners will specialize in a variety of things. It's rare for somebody to say, I only do treatment for PTSD because that's where the money is. So for example, if I'm in my own practice, I'll see individuals with trauma and PTSD and addiction and anxiety and depression, and most practitioners are like that. Some have specialties, so some will specialize in unique things like personality disorders or eating disorders, for example, and they'll say, no, this is all I do. So I haven't seen evidence that providers are migrating towards trauma or PTSD because it has more support and resources. I will say that those programs definitely have funding, and I think it's great.
Me
For
too.
example, veterans who have a lot of that. I mean, kudos, the more the merrier, right? I'm never one to be jealous of a type of patient getting funding versus other patients.
Sure.
I think it's great.
Sure.
I think the issue is how do we get others to that same space, and why is it that certain kinds of problems are getting more attention? I always like to get people to self-reflect and ask themselves, when we look at public fundraising and public awareness, we do a lot of things for cancer and such, cardiovascular disease, right? Runs, marathons, cures, fundraisers. When was the last time?
IWK, anything for children. Yeah.
Exactly.
Yeah.
When was the last time you saw a fundraiser for alcohol use disorder? Right? Or smoking or gambling, and yet mental health problems dwarf the costs of cardiovascular disease and cancer society-wide.
But see how amazing that what you just said. Most people wouldn't even think what you just said. Okay, but when you highlight it and people have to listen to it, whether they want to or not, this is the reality. Then I think they can, like you said, most people, if you try not to make them do it that way, just let their logic listen, and then you have a much better chance of success. I would think, So what I'm thinking that maybe you could help me with a little bit here, question-wise, is that if someone is having issues with crossover addictions along with the gambling, what would you recommend to them? Therapy's one, maybe AA or GA or NA is available. Is there another type of program that you think might be helpful for that kind of person?
Well, luckily, cognitive behavioral therapy is actually, again, the gold standard for all addictions.
Okay.
And that's because they overlap in many ways in how they work. It's important what you brought up, though, because there's a concept in mental health that we often don't discuss. It's called comorbidity or co-occurring disorders, which is the idea that very few people have one problem, right? So I treated hundreds and hundreds and hundreds of individuals with all kinds of addictions. I can probably count on one hand how many came in, and they just had that one problem. They just drank too much. That's it. Yeah. They didn't have anxiety or depression or trauma or relationship problems or something. They just were drinking too much. That doesn't happen very much. And yet we don't treat disorders that way, right? So we have an alcohol rehab, and we say, go here for your alcohol issue. Then you go here for your depression issue. Then you come back to me and I'll treat your trauma issue. And so we have this compartmentalization of treatment and lack of understanding that the rule rather than the exception is that most people come in with multiple things. So, for example, in gambling, there has been pretty established theory about pathways by which people become addicted to gambling. And there are three main ones, but one of them is called an emotionally vulnerable gambler. It's the idea that they're not gambling because it's exciting, because their friends are playing and there's opportunity to gamble and they play some poker to win. They gamble because they have stress, they're escaping something at home, at work, they're depressed, they're anxious, they're suicidal, they're dealing with some other issue, and gambling takes their mind off of it.
Yeah.
Right. So in this case, you have to address that other thing in order for them to recover. And so when you go to something like GA, for example, you'll talk a lot about gambling.
And just so people know, GA is Gamblers Anonymous.
That's right.
So
Yes. If you go to Gamblers Anonymous, the focus will be very much on that, but it may only be by accident that you'll talk about other things and focus on that.
Sure.
You're there for gambling. And it's very much the same in these formal treatment settings. Most practitioners will say, what's your main concern? We'll treat that. So I think an important push forward that has to happen is training clinicians and service providers in being able to deliver this kind of holistic care that treats everything.
Sure.
Now, we've known this for a while now in the scientific world, that that's the case and that it works better if you attend to everything. But the problem is translating it into out there in the real world, and the issue is that most people just don't know how to do it well. And
Sure.
so lack of training, lack of understanding, right? People don't feel comfortable delivering that kind of care. And it's also hard to design and implement at the government level, right? So imagine instead of having an alcohol rehab, you have to propose a clinic that somehow does everything, right? It doesn't work in terms of budgeting and training and justifying it to, in the office to a politician. So there have to be considerations of that because that's the rule. And I think going forward, that has to be attended to.
One of the shows I did on Halifax Cable, one of my guests said that back in the older days, you get 6 months of rehab. Now you get 7 days. Like, if you look at that, I mean, that's just such a stretch that you're talking such a long period of time you can't, and there's no funding for that. So hopefully the funding will come now that we can say, okay, 7 days is not going to do it. Somebody going in has to get away from whatever they've been around, have somebody like yourself working with them, and like I said, a myriad of different options. If we can get there, I think we can put a dent in addiction and especially suicide. That's my number one thing. Addiction is here, but I don't want to see anybody hurt themselves or get hurt because of this. And that's why I've got such a thing for this. I know it sounds crazy, but I love doing this show because if I can get just a little bit of information on somebody and they don't hurt themselves, what more can you ask for?
That's it.
Listen, by the way, Dr. Yakovenko, thank you very much for coming on the show. It's been a pleasure having you on Addiction's Road to Recovery, and hopefully we will touch somebody's life and they'll get some help from this.
I hope so. It's been a pleasure being here. Thank you very much for having me. And if anybody else is interested in this, we certainly have a lot of tremendous professionals and interested parties in the province. Nova Scotia is doing wonderful things. To my own institution of Dalhousie, there are some tremendous scholars and clinicians who are just interested in helping people there. So for those interested, you can always look it up there and reach out. And all of us as researchers are always happy to engage with the public.
And we'll get some numbers from you and things like that we can put online so that people actually know where to call. Thank you very much for coming. You've been a wonderful guest.
Thank you.